Hello, my name is Sierra. I'm a clinical informatics specialist. Today we are going to be covering how to document restraints for nursing in Meditech Expanse. The following are our objectives. We'll overview some of the highlights of restraints. We'll demonstrate violent restraint documentation in the emergency department, violent restraint documentation in inpatient, nonviolent restraint documentation, and chemical restraint documentation. So in our restraint documentation, we have the restraint assessment intervention. This will be utilized for violent and nonviolent restraints. If the nurse initiates the restraint without an order, the nurse can manually add the restraint assessments to the work list. The nurse must then acquire a restraint order within minutes of restraint initiation. Alternatively, if the provider enters the order first, Meditech will add the assessment to the work list automatically. When a chemical restraint is ordered by the provider, Meditech will add this assessment to the work list automatically. So when initiating restraints, nursing is required to chart that restraint documentation within 10 minutes, preferably within 5 minutes. If the nurse is unable to chart the documentation in less than 10 minutes, please create a note specifying why. This is for quality's review, and they can determine if there's been a fallout. Please also call the provider to notify them that of the time the restraint was initiated for violent restraints. The face-to-face notification is generated by nursing charting the restraint assessment. So if the nurse is charting the restraint assessment late, that face-to-face notification that is generated from the charting will also be late to the provider, which is why it's important that the provider be notified so that they know when the restraint was initiated and what their time frame is for their face-to-face. So when will a face-to-face be required? A face-to-face will be required when the restraint is initiated, renewed for a violent or a chemical restraint. And that face-to-face has to happen within 1 hour after the initiation or renewal of the violent or the chemical restraint. The face-to-face documentation in the emergency department will be performed by the emergency department provider. In med-surg, during the day from 7 a.m. to 7 p.m., the hospitalist is responsible for performing that face-to-face. In med-surg during the night at 7 p.m. to 7 a.m., a trained nurse is responsible for performing that face-to-face. Restraint renewal requirements. So for a patient age 18 or older, violent restraints will be renewed every 4 hours. For a child age 9 to 17, restraints will be renewed every 2 hours. For a child under the age of 9, restraints will be renewed every hour. Nonviolent restraints will be renewed every 24 hours for all patients. The restraint attestation must be documented every 2 hours. I do recommend going to Policy Medical and looking at the restraint policy for more information. So here we're going to perform some restraint documentation. I have my patient expanse test demo in the emergency department. And I'm going to approach this as if it were a nurse-initiated restraint. So I'm going to go ahead and add my restraint assessment. You'll notice that the restraint assessment says Q 90 minutes. The hospital leaders wanted to have this set up to prompt nursing to document it every 90 minutes, though it is actually required to document every 2 hours. So you have a 30-minute lead to get this restraint assessment documented. Okay, so this is our restraint assessment. First, I'll document the restraint status. We'll do an initiate. We do not need to fill out the expiration date and time. Once I fill out the restraint type, it will populate the expiration date and time. So we will do a violent restraint. And you'll see that the restraint expiration is going to be 4 hours from now. You'll also notice that a face-to-face reminder has automatically been selected to transmit to the provider. This has been marked yes. And that is because this is an initiate. and this is a violent restraint. You'll notice throughout the documentation there are stars. These are required questions that must be filled out to complete the restraint documentation. So I'm going to put assessment time as now. And what this does is it populates a restraint assessment due at time on the status board. And my nonviolent, or you'll see that some questions are grayed out. So I'll move down to the next section. So this is a violent restraint, locked extremity, specific behaviors. And here's that attestation that we were talking about. I attest that this patient was monitored every 15 minutes while in violent restraints over the past 2 hours or in seclusion over the past hour. Restraint monitoring. We're going to say yes to all. Restraint intervention. Restraint alternatives. Restraint education. We have a section that's collapsed for vital signs. If you would like to add vital signs, you're welcome to do so. We also have a section for telemetry. And in this case, I'm going to say not applied. A violent restraint does not require telemetry. However, a chemical restraint does require telemetry. And then we will save and exit. And when you are doing restraint documentation in the emergency department, when you save, you're going to get this prompt. We don't need to check anything. We can just say okay, and it will create an order for face-to-face due in 1 hour to serve as a reminder to the ED provider to perform that face-to-face. This also appears on the ED provider's tracker so that they can see the face-to-face. This other line is a restraint provider notification. This is an item that comes to the nursing work list that reminds you every 5 minutes to get that restraint order if it is a nurse-initiated restraint. I'll go ahead and continue to orders, and we'll say this is a provider initiated, and we will submit. So since we have put in that restraint face-to-face order, you can see here on the emergency provider main ED tracker on the face-to-face column, there's now a red X indicating that a face-to-face needs to be performed. Additionally, when the provider has put in a violent restraint or non-violent restraint order, the restraint renewal will appear here under restraint expiration, letting me know that this restraint order is going to expire in 4 hours and either needs to be renewed or completed. So I'm in here as the emergency department nurse looking at the ED tracker at my expanse demo patient, and I can see that the restraint expiration is marked right here on the tracker. After documenting a restraint assessment, you'll notice that the restraint provider notification has been added to the work list, and it will have a clock every 5 minutes until it is documented. I'll go ahead and take a look at this. So provider was verbally notified by the RN of initiated restraints, and a provider order is required to be filled within minutes to authorize use. So we're going to say yes. And save and exit. And after completing this documentation, if I hit the refresh button, it will remove the line and all the clocks. This is a friendly reminder that if you are not able to document your restraints within 10 minutes of initiation, we would like you to create a note. And one of the ways that you can do that, you could start your documentation and then you can click the add note function here. And this links the note to the restraint documentation. And then you can carry on with your documentation. Now, I want to take a moment to talk through the different restraint statuses for a violent restraint. So when we first initiate restraints, we're going to put the restraint status of initiate. And 2 hours have elapsed since the initiation of restraints. The status will be monitor. And 4 hours has elapsed since restraint initiation, we are going to renew because our violent restraints are renewed for adults every 4 hours. At the 6-hour mark after restraint initiation, we would monitor again. When the provider wants to stop restraints, the status would be discontinue. Let's say that this patient was an inpatient. I want to highlight the difference of documentation. So I'm going to just quickly step through documenting the restraint assessment for a violent restraint. And I'll be doing an initiate violent because I want a face-to-face trigger. Here's a key difference is an inpatient, we want the restraint plan of care to be added. So when I mark this as yes, I'm saying that I added the care plan, and I can step through adding that care plan with you in just a moment. So here we are being prompted that the restraint face-to-face intervention is going to be added to the nursing work list, and the restraint provider notification is going to be added to the nursing work list. So now we have face-to-face and we have provider notification. Provider notification, again, is to serve as when a restraint is nurse initiated, that we are getting an order from the provider within minutes. When it is night, a trained night nurse will be responsible for performing the restraint face-to-face. And we would just go to the documentation and start to fill that out. Save and exit. This prompt is asking if I'd like to complete the intervention, and since I have completed the face-to-face, that is appropriate. I hit refresh, both of these that are marked complete will fall off the work list. And I wanted to pop back to the PCS status board to show you that the restraint expiration does show here on the board. So earlier in the restraint assessment, we saw a question of, was the care plan added? To add the care plan, you come into here, you go to plan of care, we go to add, we go to care plans. So from this screen, we can see non-violent restraints, and if we hit next, we'll see violent restraints. So if you're adding, if the patient has violent restraints, you would want to add the violent restraint care plan. If they had non-violent restraints, you would add the non-violent restraint care plan. And then just, okay. Now let's talk through restraint assessment as if it was a non-violent restraint. So I still add my restraint assessment like I did before. I come into this documentation, I would initiate my nonviolent restraints. I would say nonviolent. The send face-to-face reminder is marked as no. And you'll notice that different questions are grayed out. That is because some questions are specific for nonviolent and some questions are specific for violent restraints. The restraint type will be a soft extremity, nonviolent only. The attestation only applies to violent or seclusion. And we still have our vital signs here that are optional. We're going to not apply tele. We'll save and exit our documentation. And we're getting this pop-up that we're missing a required field. When I close, the required field will appear in green at the top of the screen, and I'll fill it out. And here is the chemical restraint assessment. Since the provider will order the chemical restraint first, the chemical restraint will trigger the chemical restraint assessment to come to the nursing work list automatically. The reason the chemical restraint assessment is separate from the other restraint assessments is because of the timing for these, because vitals are due every 15, 30, and then every 2 hours. We also don't need as many restraint statuses. So I'll mark this as an initiate. I want to take a moment to note that if physical restraints are applied, you do need to document the restraint assessment in addition to the chemical restraint assessment. And we also have these other two questions that are specific to chemical restraints. Was physical hold used during a chemical restraint? Yes, no. Was violent physical restraints applied at the same time as a chemical restraint? Yes, no. And I do want to say that the chemical restraint order is named chemical restraint with physical hold to cover if you need to perform a physical hold during a chemical restraint. Face-to-face reminder is going to be triggered because of the initiate. And I will want to document vitals. If you're unable to acquire vitals because the patient is uncooperative, you can make a add note and document that. And we are going to want to mark telemetry on this one. And then we will go ahead and save and exit. If you have any questions about restraints, please contact your supervisor or your charge nurse. If you are having issues with the functions of restraint documentation, please contact our IT help desk. Here's a phone number and a jot form, and if this is an urgent matter, please call. Thank you for reviewing the restraint education. Have a nice day.